Good morning, y'all. Okay. Carlos, is it okay if I walk back and forth?
Yes, it is.
Okay. Sometimes I like to do that. How y'all doing this morning? Okay, good. My name is Michael Ruth. I work for the hospital. I've worked here for about 20 years in various positions. Okay, right now I'm with the compliance department. There are three of us in the compliance department right now. There's Michelle Pendergrass. Michelle is our compliance director. She's director of compliance and actually the compliance officer. There's myself. I'm a compliance auditor. And then we have a third person who helps us, Debbie McCord. She is our compliance staff assistant. Okay, so that's three of us. As you may know, however, there are about 16 or 1,700 employees here at Midland Memorial. So let me first ask this. When you think of compliance, what do you think of?
Guidelines.
Values
Guidelines.
and guidelines? Very good.
Communication.
Communication, okay. That's a real important part. I'm glad you said that.
I'm good to communicate, trust.
Okay, good, good. Well, we have these guidelines, values, communication, rules, regulations. How do the three of us communicate those to 1,700 people and to try to make sure that the 1,700 people understand about our guidelines? How can we do that, do you think? I'm sorry?
Make sure they're comfortable and they're set.
Okay. Okay. Yes, sir?
Old phrase that's always been said, each one teach one.
Okay.
More of like a word of mouth or meetings or within your department changes. You having your monthly meetings or weekly meetings.
Okay.
Whenever changes emails are sent out, via updating your department and letting you know these are the changes, these are the opportunities that are going on, changes compliance wise within your department.
Very good. That's good, and that goes along with the communication. We have to be able to communicate top down, okay? So that's very important. On a day-to-day basis too, there's another way that we have improved our compliance department. Our compliance department now consists of 1,600 or 1,700 people, okay? Because you are an important part of our compliance department. One of the things you'll hear from me today, over and over again, hopefully, is that we want you to communicate with us. Anytime you have any concerns about compliance or anything you see, we want you to feel free to come to us and express those concerns, okay? We have a very open door policy and somewhat of an anonymous policy. So if you're concerned about something that you see, but you're not sure whether or not you really want to put your name to it, that's okay. You can let us know anonymously, and we'll talk about how to do that later. Right now, I just want you to know that you can do that. There is no fear of retribution at all. We cannot allow that to happen, okay? So we want you to feel free to do that. Let's talk a little bit about what else the compliance department does. As you can see, we deal with several different agencies: the Department of Health and Human Services, the Office of Civil Rights, the Office of the Inspector General, Centers for Medicaid and Medicare Services, and even the IRS. If any of these agencies come into Midland Memorial and ask to see any kind of records or any proof that we are in compliance, chances are they'll be referred to the compliance department. And we're the ones who say, yes, Midland Memorial Hospital is compliance, and here's all the documentation to show that. We deal with several different issues: HIPAA privacy, HIPAA security, anti-kickback issues, something called the Stark Act, even billing and quality. We deal with all those issues. Responsibilities of the compliance officer include the compliance program plan, dealing with the False Claims Act, dealing with the Stark Law, dealing with anti-kickback issues, and even dealing with the Code of Conduct for employees. If I had to sum up what compliance is just doing the right thing, okay? And we pretty much know what the right thing is. There are going to be situations you run across as you're employed here where you say, I'm not exactly sure what the right thing to do here is, okay? Sometimes there are a lot of gray situations. In those cases, you can go to your supervisor or you can go to the compliance department. We will try to help you in terms of deciding what is the right thing to do. The code of conduct is your commitment to Midland Memorial as an employee to legal and ethical behavior, okay? Ethical behavior gets back to when there are no fast and firm rules, okay? And you will run across situations where there is not a rule, but you're not sure what to do. In those cases, we will try to help you decide that. Part of being a compliance officer or a compliance department is dealing with the law known as HIPAA, and you'll hear a lot about HIPAA, which is the Health Insurance Portability and Accountability Act. The compliance officer is also the privacy officer. They deal with HIPAA privacy, HIPAA security, and HIPAA training. This may be the first time that you undergo HIPAA training. It won't be the last time. At least annually, you will be going through a review of HIPAA issues. We talk about something called meaningful use, and meaningful use usually has to do with electronic health records. We kind of broaden that out. We say that meaningful use means if you have access to information, but you don't need that information, please get out of it and do not access it. We'll be talking about that more in a minute. As I said, we deal a lot with HIPAA. It's been around since 1996. It's federal law, and it sets standards and rules for the exchange of protected health information, or PHI. And it promotes privacy and security in the use of PHI. HIPAA, of course, applies to employees. It does apply to physicians, allied health professionals, business associates, volunteers, independent contractors, and vendors. Anyone who comes across protected health information or any type of secure information regarding patients is under the HIPAA guidelines. Every access into a medical record can be tracked. We're conducting audits and continue to do so. Let me talk a little bit about audits because that's part of my job. How many of you here will have access to the electronic medical record? Okay, you will certainly. How many of you here will have access to some type of patient information? Everybody here will have access to some type of patient information at one time or another. For those of you who do have access to the electronic medical record, from time to time, I may contact you via email or telephone. And I will ask you, hey, I noticed that on March the 24th at 10:30, you accessed a certain record. Can you tell me why you accessed that record? I'm not picking on you. I'm not accusing you of anything, but it's part of my job to do that audit, to make sure that you have business in the record and to make sure that the record stays secure and that the private information remains private. So anytime you get a call from the compliance department, don't feel like you've done anything wrong, okay? We just need to know why you were in a certain record, and we need to make sure that the record stays secure and private. One more thing is that from time to time you will run across a record that says this is a sensitive record, okay? Don't let that stop you from going in if you need to go into that record, okay? We just want you to know that that record, for whatever reason, people may want to get into that record, okay? And we are watching that record especially. The bottom line is, if you don't have to get into a record, please don't get into the record. We have a progressive discipline policy here. There are 3 levels to it. Level 1 is if you commit an unintentional breach. For example, if you accidentally give out the wrong information or you accidentally go into the wrong record. In that case, we give you a verbal warning, although if it's more serious, it can lead to suspension. Level 2 is curiosity or concern with no personal gain. At that point, you can receive a written warning, but if it's severe, it can lead to termination. Level 3 is where you commit a violation and you do so for personal gain or to be malicious or to cause harm. At that point, you probably will be suspended or it could lead to termination. By the way, we will not take any kind of retaliatory action against anyone who reports a violation. If you see a coworker who's violating HIPAA, you have the right and responsibility to let us know without fear of retaliation. We're going to look at some HIPAA violation examples, and what I want you to do is to tell me if you think it's a level 1, level 2, or level 3, and we'll discuss these. First one, a patient's being discharged from the hospital. Now the nurse goes over the discharge instructions with the patient and has the patient sign the documents. Now upon the patient arriving home, they realize the labels on their discharge instructions do not belong to them, but belong to another patient. What do you think, level 1, level 2, or level 3? Okay, I hear level 1 because it's not intentional, and that's very true. Chances are this happened during shift change, because if you've ever worked on a nursing unit, you know that shift change is a real busy time. You've got 2 shifts of people. Chances are you've got patients who want to go home if it's around 2 or 3 o'clock. You're trying to get paperwork out. The unit coordinator is trying to give you paperwork to give to the patient. You've got a stack of labels, so you're trying to do things quickly. This can also apply to other paperwork in the hospital. You've got labels, you've got paperwork, you peel the labels off, zap, 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 put them on the paperwork, go into the patient. For some reason, patients don't read the paperwork right then and there, I think because they're happy to go home and they're anxious to go home. Then once they get home and they settle down, they realize, wait a minute, this is Jane Doe's paperwork. My name is John Smith. They gave me the wrong paperwork, okay? So this is important for 2 reasons. For one reason, you've breached someone else's confidentiality. Does anyone know what the other issue is with this? They don't have the right instructions, and they don't know if these instructions go with them or not. The best thing to do is to take a few extra seconds and to make sure the names always match. And that's how you can avoid this. And y'all are right, this is a level 1 violation. Okay, a 20-year-old female comes to the hospital with severe abdominal pain. Remember, she's 20 years old. The patient's mother is with her and is also a nurse at the hospital. When they get into the emergency room, the nurse proceeds to access her adult daughter's electronic medical record to view test results. Is this okay? No. Why is it not okay?
It's not your record.
Okay, it's not your record.
It's not your record, and then you're not like medically attending to that patient.
Very good. It's for personal use. The daughter's 20 years old. She's an adult. She has the right to say who is or isn't in their record. Okay. One of the things I'll tell you too is that under HIPAA, patients have a right to know who accesses their record or who doesn't access their record. If you're ever a patient here in the hospital, when you get out of the hospital, you have a right to say, hey, I want to know who was in my electronic record, and we can run an audit. We can give it to you and say, here are all the people that were in your electronic medical record, okay? Now you're right, in this case, she didn't have any business going into this record. Do you think this is a level 1 or level 2 violation?
2.
Why do you say 2?
Because she didn't want to do harm.
Okay, she didn't want to do harm, so it's not a 3, but it was intentional. It was definitely intentional, okay? This is a level 2 violation. Okay, a coworker is admitted to the hospital. Now you consider your coworker a friend. You're concerned about your coworker's well-being. So being a nice person, you decide to access the medical record to see what's wrong. Okay thing to do? No, not a good thing to do. What level do you think? Okay, 2. It wasn't done for maliciousness sake or for personal gain, but it was done intentionally. A few years ago, we had a physician in our community who was also one of the physicians here at the hospital, and unfortunately he fell sick and was admitted to the hospital for about a week. We knew that people might be interested in his record, and sure enough, we ran an audit and we found out that one of his office staff had accessed the record. We had to call the member of the office and say, why did you access Dr. XYZ's record? She knew she was in trouble, and after a few minutes of talking to her, we could hear her start to cry a little bit and say, you don't understand, Michael. He's a friend of mine. He's not just an employer. He's like my dad, and we've worked together for years and years. I'm compassionate, I understand that, but at the same time, it was a violation of his privacy, and she committed a violation of that privacy. If you're concerned about your friend who's in the hospital, what can you do to show your concern? You can visit them, send them a card, send them flowers, send them a balloon. Make sure it's a Mylar balloon if they're latex allergic, okay? There are a million different things you can do, but show your compassion and your concern for your friend's well-being by doing the right thing. Please don't go into their record. You're right, this is a level 2 violation. Okay, an overdose patient is brought into the emergency room via ambulance. Now stop here a second. What do you think of when you think of overdose? Drugs. Okay. A heroin overdose or a narcotic overdose, something like that. Okay.
Or you could do alcohol.
Alcohol, could be alcohol. You're right. The patient comes in alone and is not coherent. The nurse assigned to the patient knows that the patient works for a company owned by a friend of the nurse. So the nurse contacts her friend, who happens to be the patient's boss, and lets her know, hey, your employee John Doe is in here in the emergency room for an overdose. Okay. Let's talk about that. Good or not good? Not good. Okay. Did she have any right to do that? No, had no right to do that. Chances are she didn't even have any business in the record. If she did have business in the record, she had no business discussing this. These are all true examples, and I want to talk about this one because remember I asked about what you thought of with overdose. Chances are when you first come in a case like this, someone may say overdose. In this case, it was not actually an overdose. It was a reaction to some medication that had been prescribed, and the patient didn't know they were going to have this reaction to the medication. The doctor didn't even know. So it was a medication reaction. The patient was treated, the patient was released. The patient went back to work, and what was the first thing they heard? Hey, I heard you were in the ER last night for an overdose. Not good, okay? Level 2 or level 3 violation? Okay, you're saying 3? Why? She intended to do it? You think it was malicious? Yeah, it was malicious. Yep, danger to their employment. You are correct. Level 3 violation. Very good. A patient access employee is currently going through a divorce. Now, the soon-to-be ex-husband has a new girlfriend. Fortunately, we find this scenario more and more, and it could be the other way around, okay? It could be an ex-wife or with a boyfriend or whomever, but the new girlfriend is brought into the ER for severe abdominal pain. It's found to be an ectopic pregnancy. Now, the nurse in the emergency room is friends with the patient access employee and calls to inform her friend about her friend's ex-husband's visit to the ER with a new girlfriend. The patient access employee then enters the new girlfriend's electronic health record to snoop around. Okay. See head shaking going, no, you can't do that. Okay.
That's number 3.
How many people are in violation here?
How many people? Are in
Yeah.
violation?
How many employees are in violation here? 2, right. The nurse in the ER and the patient access employee. Okay. Although Midland is, I don't know how big we are now. There's no telling 150, somewhere between 150,000 and 200,000, who knows. We still only have one hospital, and in some ways we're still kind of a small community. That sounds strange, but in a way it is. Everyone still seems to know everybody else, okay? You're gonna run across a situation where you know someone who's related to somebody else or who has been related, okay? Please keep out of the records, and please don't tell someone if their ex-husband or ex-wife or ex-lover or ex-neighbor or whatever is in there, okay? Please keep it to yourself. Level 3? Yeah, you know it. Definitely level 3. Okay, this happened actually a couple of years ago. A well-known Texas celebrity was brought into our emergency room, and that does happen. Why a celebrity would be in our emergency room, I don't know, except that if someone gets sick between New York City and Los Angeles, they're going to get sick in Midland County. Why, I don't know, but it just seems like it works that way. They get sick on the interstate, end up in our ER. And now the patient was marked as a privacy patient in our system. Not only did the employees inappropriately access the patient's electronic health record, but some were bold enough to leave the unit they were working on to go to the ER and request to meet the patient. Okay. Good, honest mistake.
If
Yes.
that is the case, do you guys do no patient ID? You guys go into no patient ID under their checking in?
Okay. When they are a privacy patient, what that means is that you cannot say anything about them if someone calls or asks. All you can do is to say, I'm sorry, I can neither confirm nor deny that this patient is here. Okay. Let me explain a little bit between a privacy patient and a regular patient, or what we call a directory patient. Let's say that you come in, I'm sorry, what's your name?
Daquan.
Okay, Daquan?
Yes.
Okay. Let's say that you come into the hospital and you say, I don't care, I'm not a privacy patient, okay? Then if one of you calls me and says, hey, is Daquan in the hospital? All I can do is tell you, yes, he's in the hospital. He's in whatever condition he's in. And he is in, and I can tell you the general unit. He's in critical care, or he's in a surgery area, or wherever, okay? That's all I can say. Now, let's take the same situation. You come in and you say, I want to be a privacy patient, okay? And Catherine calls up and Catherine says, hey, is Daquan there? All I can say is, I'm sorry, I can neither confirm nor deny that he's here, okay? And that's it, okay? Privacy patients, you can't say anything about. Now, when they are registered, we do have to register them under their proper name. We can't use a pseudonym or anything else, because if they come in again, then we have to be able to match medical records.
Okay, so you
Okay.
guys don't use no patient ID?
No, we usually don't. Now, if they come in and we don't know who they are, then obviously we have to register them as a John Doe, okay? But otherwise, we have to change it because we have several different systems we use, and the systems all have to match up.
So you guys score them as a privacy.
Yeah, they're marked.
The reason why I'm saying that is because you get patients that are like that, and on confirmation, if you're dealing with their medications on a daily basis, or whatever aspect you're dealing with that patient, it's known across to say no patient ID. So people call in and go to each department. They'll call all departments trying to figure out
Oh,
what
yeah.
patient is that.
Oh, yeah.
They'll do it.
And that is a problem that we have, is that with some systems it's easy to mark privacy, with other systems it's not easy to mark privacy. So if you're ever not sure and you suspect that a patient is privacy, you have the right to say, I don't know, I can't help you, sorry, okay? If you're ever not sure about that, then you can always take the conservative route and say, I don't know, I can't tell you, sorry, click, okay? And you won't get into trouble for that, okay? Level 3, yeah. The other issue here is that some of the nurses left their units, okay? Many times we're short-staffed enough, and if you leave your unit, that's not a good thing for the other patients. Yes, level 3 violation. A few years back, even though HIPAA's federal law, states were allowed to make their own HIPAA regulations, so to speak, more stringent, okay? A state can't make it less stringent, but they can make it more restrictive. Texas was one of the first states to say, you know, some HIPAA violations need to be felonies, okay? And they made some HIPAA violations of felonies. These carried a $50,000 fine per occurrence for the hospital and up to 1 year in prison for the violator. Okay? These were especially true for level 3 violations where someone was doing it. For example, if you gained access to information and you were selling the information for profit, okay? Texas was the first one to do that, but now most other states have developed HIPAA laws that are as stringent as Texas. If I have a list of Social Security numbers and I'm a crook and I go out on the street and I sell that list of Social Security numbers, Social Security numbers sell now for between $1 and $5 a piece. On the other hand, if I have medical record information, that can sell up to $50 to $100 a piece. And I'm not telling you that so you'll run out and make some money. Please don't do that. But the reason I say that is that people will try to access information to make money, okay? Okay, what do you report? Well, if you see a breach of confidentiality or anything that you're worried about as far as a patient's privacy, report that to us. Unethical relationship with vendors or contractors. Again, let me stop here. Our vendors and contractors that we deal with are, for 99.9% of them, they're honest, they're above board, and they really want to work with us in an honest fashion. There are, however, vendors and contractors out there who merely want to sell something and will take, unfortunately, they'll take any type of information they can to make a sale. The Office of the Inspector General of the United States spends a lot of time tracking these people down. Give you an example. Let's say I have a list of orthopedic patients, and let's say that my best friend sells walkers and orthopedic equipment. That information is going to be valuable to him, and he may try to gain that information. As I said, I'm not trying to cast anything bad on most of the vendors and contractors. Most of them are very above board and are willing to work with us. But you do have to be aware that there are some vendors and contractors who want information to make a buck. Fraudulent or false claims. Anytime we file a claim with an insurance company or with the government, we are saying, yes, we provided these services, we provided these drugs, we provided these pieces of equipment, whatever. We're verifying that. If we aren't verifying that, then we are submitting a false claim. And if any time that you're aware of that, please let us know. Unethical behavior, unethical or inappropriate care of patients or equipment. You have a right and a responsibility to report that. And any bribes or kickbacks, you have a right and a responsibility to report that. Okay, how to report. We tell you to communicate the issue with your direct supervisor or manager. To be honest, there may be some times that for whatever reason you don't want to do that, and that's okay. There are two other ways of doing that. You can call the compliance hotline, 877-780-9367. It's also posted throughout the hospital. By the way, the compliance hotline is not here at the hospital. I don't even know where the compliance hotline is. It could be anywhere in the country. What happens is we contract with a third-party agency. When you call, they take the information. You don't have to give your name. If you want to tell them you're Mickey Mouse, then that's fine. They will ask for all the information, give them the information. Afterwards, they will give you a code, and you can call back and you can ask what the status of that case is. You can also contact our department at 1543. Chances are you'll get Debbie or Michelle or me. It's just three of us. Any way that you want to communicate with our department, that's fine. We're up on the second floor of the old building. If you want to come by and slip something under our door, you can do that. If you see us in the hallway and you want to grab us and say, please come, I need to talk to you, you can do that too, okay? A successful compliance program depends on every individual. So please call us, let us know. There will not be retribution. There are penalties for violations. I won't go into that, but of course there are penalties that we've talked about. And we reserve the right to report individuals to the appropriate regulatory agencies for further actions. If we see, for example, and I'll pick on pharmacy. You work in pharmacy, right? Okay, I'll pick on you. If we have reason to believe that once you leave here, you're going to continue your horrible criminal actions, then if you are licensed by the State Board of Pharmacy, we have a right to call the State Board of Pharmacy and say, hey, watch out for this guy. He's bad. Okay? We won't do that, but because you're not bad, but just as an example. Okay, it's every individual's responsibility to report compliance violations. When in doubt, call the compliance department. About a year ago, one morning, I picked up the phone, identified myself. I don't know who it was, but it was an employee at the other end of the line who wanted to know what they were serving in the cafeteria. I don't know if they had dialed the phone on accident or they had heard me say, contact us for any questions, but they contacted me and I told them, hold on a minute. I'll either try to find out what's in the cafeteria or I'll direct you to the right department. My point in telling that story is that we don't mind you calling us for any reason. Please call us. Please let us know if you have any concerns. Any questions about anything so far? Okay. In your packet, you will find a document that says confidentiality and security agreement. It looks like this. Small typing and some boxes at the bottom. Okay. What I'm going to ask you to do, three things. And by the way, you don't have to fill out information in the boxes because they're small. If you want to, just at the bottom, please first print your name. Okay. Print it nice and neat so we can read it. If you don't have one of these, I've got some extras and I've got a pen if you need. Okay. You go, sir. So please print your name. Then if you would, please sign your name. Then after you sign your name, please date